I'm not saying, no, we have to finish this first. I'm not saying to say that, but I'm saying, a lot of times the pleasantly confused elderly or anybody with Alzheimer's or head injuries, they just tell you stuff. Like they don't tell you what you're asking. So make sure that they're not throwing you off your game, okay? And then when we're looking for strength, this is what we routinely do. So how do you put your fingers down? Can you squeeze my hands? So you always want the patient to squeeze both hands, okay? You're checking for symmetry of strength, okay? And then also you could, this is asking here for sensory deficits. So you can say, can you close your eyes? Can you feel me touching on both sides? You can do that. And then, and then you come down here. You tell, this is what we do. We have, can you push against my hands like you're stepping on the gas? Pull your tippy toes up towards you, okay? And the same thing, can he feel if we touch our legs, okay? So that pretty much encompasses most of your neuro CPE that it's asking you, okay? So if you look back to my other sheet, they kind of link with the pupils. Do you see that? Whereas your eyes are 2 more down.
Yes.
Not a big deal, okay? It does go part of the neuro assessment in the hospital. It's definitely listed as part of the neuro assessment. Okay, so who's got a pen light? Does it have the things on the side? Okay, did you buy this in the bookstore? Okay. Did they have ones with the little?
It came in a kit. This was the store, so yeah, same one.
This makes me so mad. Makes me so
So you want
mad.
the eye size on?
I want the eyes on the side. Everybody got the eyes?
No, I don't know if the one I got at home.
How much did this cost?
Mine's not even working after I dropped it.
Did they have the ones over there?
I don't
I
think so.
think there was. Are you talking about like the 2 buttons?
No.
No, the chart on the side shows
That
all
says the pupil size.
sizes.
Because do you know what a size 2 or 3 pupil is?
No.
No, absolutely not.
I-
So do yourself a favor, buy a pen light. I mean, you can try to return
eBay.
it, but I don't know how much they cost. But it came with this, so it's free. Okay, there you go. Buy yourself a pen light that has the eye sizes on the side.
I think Super Shoes has the one I got.
Okay, so then what we want to do, have you guys played with your pen light at all? Have you done anything with it?
Yeah, mine,
Yeah.
I'm not kidding, it broke because I just dropped it on the floor. It was working when I sat over there, and now it's no longer. It was free of my stuff.
Okay, well, you're over. Yep, you gotta buy this. Okay, so what we're gonna do is you're gonna just shine this light into your patient's eye. You come from the side, okay? So you wanna come from the side, shine into that eye, and then you wanna come over here and shine into this eye. I cannot tell you how many of your patients are gonna say, wow, no one else has done that.
Why?
Because
They don't?
They just don't.
Just trying to write your eye, right?
No,
They're
they
gonna-
just
oh,
don't
they're
check
gonna-
your pupils at all.
Oh, I see.
Yeah. So then what we say to them is we say, so PERL. Did Sue cover this in class yet?
No,
No.
but the
She only had 2 classes. Huh? So PERL means pupils. P is pupils. E is equal. So do they look equal? Okay. RR is round, react to light.
Okay.
Okay. And then the L is the light, react to light.
Okay.
And then the A is accommodate.
Okay. Where's the A?
The A is not on there.
Okay.
But sometimes the A is on there.
Okay.
it is on the, so
For a
it's
lot
Is
of
it on? Is it,
this one.
Okay.
it's on ours.
it's on your CP,
Ah.
but not on
Okay.
this one. So people get crazy. These are the 2 choices. It's either PERL or PERRLA. Don't get crazy. Doesn't matter. Okay? You need to know how to check your patient. So then we've shined a light into his eyes. Your only 2 options are sluggish or brisk or non-reactive. Okay? So most people's eyes are going to be brisk and respond. If they're sluggish, what would make somebody's pupil sluggish? Brain damage, drugs, any of that type of stuff. Also, people might have unequal sized pupils, okay? And that's actually specifically called anisocoria, and it's just different sized pupils. And sometimes people have that and they just are born that way and they've had it, or other times it's related to a head injury. And then you say, I need you to follow this pen or pencil or whatever you have, a flashlight if you're at the hospital, it doesn't matter. And so can you just track this, but keep your head nice and still and have them follow?
That's a combination.
No? Nice try though.
Yeah, I'm trying to
Yeah.
come up with the A.
So I'm checking all three cranial nerves when I have them do that. It's 3, 4, and 6. Okay, so what happens is you make them look in each direction. People with like CVAs, head injuries, all that kind of stuff, you'll see that they don't really follow. They try to track it, but it doesn't really work, okay? And also that sometimes people, when they start to track an object, they might have that nystagmus, which is like the twitching, okay, the jerking of the eye. That didn't happen. Then you're out here, okay? So then you go like this, and see how his eyes turn inward, okay? When your eyes turn inward and you're out here and it comes in, that's convergence. And then accommodation is the being able to focus on that near object.
Yeah,
So
Millie did
convergence,
that
huh?
on the last day of class. She went over it really
Who did?
quick. Ann Millie.
Okay, so what happens is you have them follow, la 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 la, and then so 3, okay, up to each corner, or up to each top, and then up to the side. So it looks like this and like that. 1, 2, 3. However which way you want to go, there's no special way, but you're hitting all ranges to have them check, okay? Then you're out here, and then you say, continue to follow my light, and then their eyes come forward, and if the convergence is your eyes turning inward, and the accommodation is that focus on the near object. Okay? So we're good. Okay, so then, head and neck. So then if we go back to our physical assessment competency, it says head and neck. So you're going to inspect your head for masses, lesions, symmetry. Why would eyes not be symmetric? Well, it says symmetries of eye, symmetry of face. Sometimes people have injuries, people have orbital injuries, facial, a lot of bar fights. A lot of bar fights where people's cheeks are not in the right spot, so that one eye sits lower. Also Down syndrome, people like that, fetal alcohol syndrome, their eyes are not, placed like, so sometimes their eyes don't look of normal proportion or spot on the face, so you maybe would note that. Then we're also looking for symmetry, so if we want them to, of the facial features, we could also make them smile here. So have a patient smile, you're looking for symmetry of the smile. Who's going to not be symmetric? Strokes, right, people with deficits, things of that nature. And then what else do we have? Okay, so it says position of the trachea. So your trachea should be midline. Okay, so what you want to feel is you can feel everybody's trachea here. Okay, so it'd be midline, and then what you have somebody do is turn your head this way, and you've got the jugular venous distension would be like if there was a lot of extra fluid, it would be pulsating out. Okay, so you can turn and just see. You'd never press on both sides at the same time, right? Because you're including off flow to the blood to the area. And he does not have a good job. You have no jugular venous distension. Okay, and that's done with the head of the bed, like about 30 degrees. He might be a little bit higher.
Semi Fowler.
Yeah, very good. So for your purposes for the CPE, just make sure you know all the things that you'd be checking for. But in the hospital, if your patient's not a head or neck trauma, there's not a specific head or neck category. Does that make sense to you?
Is that possibly why we're not pinlighting them all the time? Well, you guys.
No, because
Just laziness?
That's neurological, isn't it?
Look what it says though.
What?
Like we want to.
It says
Yeah, you-
pearl.
Oh, yeah.
So if you say yes to that,
You're really
and
lying.
you're lying.
So,
So if you say yes every day and you didn't shine a light in somebody's eyes, that's not gonna hold up in a court of law.
Yeah.
Just saying, don't be that nurse. You can try to be that nurse if you wanna be that nurse. Cut corners, do what you want. There you're gonna see all kinds of stuff. I'm saying, you're saying yes or no that I shined a light and looked at his pupils. So if you don't do it, that
You
is
should be doing it for every assessment for every patient every day.
absolutely, if you're charting it in the computer. Now, you go to the hospital the first day and you have that whole tool, you've just seen how big it is, they might pick little pieces and say, can we look at respiratory today? Because you know, you're just gonna do vitals, respiratory, and pain. So don't get crazy about, do what Kristen tells you to do. Because we have to wean you in, because it all takes so much time to get to be able to do the whole assessment. Okay, so now we're down to, so we did head and neck, we did eyes, ear, nose, and throat, okay? So you're expecting the ear, so make sure that you've looked at this sheet, you're looking for any drainage. Who's gonna have drainage from their ear? Surgery in their ear, maybe, huh? Yep, a ruptured eardrum, head injury, all kinds of stuff, a bar fight. And then you're inspecting nose, if there's any discharge, then you're actually asking them to open their mouth. It says use a pen light, so open your mouth, look all the way around, look at teeth, look at gums, things of that nature. Okay? So this top part is not too tricky. You guys should be able to do that, okay? You do need to do a complete, we're going to work hard on practicing today. Now, cardiovascular. Count the apical pulse for 1 minute and assess regular rhythm. You need to verbalize that, whether it's regular or not. So what about the apical pulse? Can you guys tell me?
The PMI.
Okay, so where is it?
Um,
I'm going to steal this one.
yeah.
I forgot what this is called, but you
It's the,
intercostal?
No, this is the
Is it going to be in the same spot on everybody?
ankle.
No. And what is the issue? Did you guys all try to find your own?
yes.
Okay, so you all tried to find your own, huh?
It's the fifth.
So what you want to do is you want to try to find your own, and you want to try to count for 1 full minute. What's the issue? On a male, should we be able to find it?
Oh, yes.
Okay.
Much easier.
What about if somebody weighed 400 pounds?
It'll be harder.
It's going to be much, much harder, okay? So, what are we going to do there? What about the woman with the very huge breasts? How's that going?
You're gonna have to look it up.
You flop them up.
Okay, and everybody says that, and that sounds great, okay? It's probably what your textbook told you.
Yeah.
Okay, how's that gonna go?
Different.
Well, no, I'm not even just saying that.
But she can like hold it to the side for you.
You need
Like,
help? Someone hold it in place.
It depends on a couple of things. It depends on the age of the patient. Some people's breasts are actually in their abdomen,
Yeah.
okay? Because they're so big and they're so saggy and they're here. So if you lift up a very huge breast, you're going to be in somebody's stomach. Perhaps. Perhaps. Just saying. I have had to go above a breast before to hear apical. So just don't be adverse to that if you feel like you're in somebody's stomach. Okay? Because you have to get through that tissue, and it's very, very hard in some people. Okay? Men, we don't have as many problems. A lot of obese patients in the hospital. There are multiple patients over 350 pounds. Many of your patients will be large. It's very hard to hear. Make sure Kristen helps you find an apical pulse if you can't find one. You should all be able to hear one on each other today, so if you can't, I need to help you. Okay? So really what you're doing is finding, you can feel with your fingers and find where you can hear. Mine's very good. Anybody could listen to mine, okay? And it has to do, like a lot of you guys are pretty thin too, and a lot of times dealing with a lot of adipose is easier as well, okay? So you're going to count for 1 full minute. And now, did you all count, did anybody count theirs or listen? You can listen to your own with your stethoscope. Did you try that? No. Okay, so you want to try that.
Right now?
Yeah, try that.
You should be able to feel it.
Yeah, are you supposed to feel it?
I can feel mine.
Yeah, well, if you can't feel your heart right there, you're dead.
Your heart rate?
It's your heart.
So everybody try it. Take your.
Cool story.
Free or?
No, it's like.
It's kind of like if you take your bra. Yeah, move your bra.
I can't feel it.
Well, that's what you're feeling.
Oh, I can feel it now.
You're feeling your heartbeat.
No,
That's what
yeah,
your
it's like-
apical pulse is, ladies. Is your heartbeat.
Yeah.
Even though I feel it from here, but it's traveling down there.
Oh boy.
I don't know how to explain it.
This is yeah.
Oh.
You can feel. Okay, so now to put your stethoscope in your ear, and then stick it underneath your shirt. Everybody stick another name for sure. Try to find it.